Hey, this is Brandon with ChiroUp. Today's blog brought me to a Facebook post that I saw about a week ago, and I want to talk about that Facebook post and then explain why I think it's important, and then maybe another alternate solution to the problem that was presented. And the reason I want to bring this up is because so frequently I hear about gurus, practice management. What do I think about this technique? What do I think about this system? And I give the same response to everybody, and everybody gets a little frustrated with that. But there really should be only one guru in your practice, and that should be evidence. And the reason I say that is because when you have a system, a technique, a treatment methodology, a tool, those things are important. Those are all methods to make something happen, but they all need to be done for a certain principle, meaning when you have a tendinopathy, you need to create a controlled inflammatory response. When you have a broken foot, you need to go see an orthopedist. And we have to answer to research when we look at clinical prediction rules to decide who goes where, who we should treat, who we shouldn't treat, and then to make sure the methods that we're using have some validity. That way, if I get called into court, I talk to a medical doctor, I talk to my grandmother, I have rationale behind what I'm doing, not I went to a seminar and they told me do these three simple steps. That's not good enough anymore, and that's never been good enough, but it has dominated the chiropractic landscape for a long period of time. Now, getting back to that Facebook post, the post, and I'm not being derogatory at all towards the person who made this, and I think that it's wonderful. In fact, 15 years ago, I would have made the same post, and I'm going to show that to you now because I think it's important to look at. And so when I pull it up here, and what you can see here is this is how to do research in your practice. It is create a Google Scholar account, create PubMed alerts, and I highly recommend doing that. I do the same thing. And then what else can you do? You can subscribe to YouTube channels and podcasts. You can search Pinterest boards for different visual graphics. You can create a ResearchGate account. You can start to use Foxit readers, which is how you can actually save a lot of stuff into a virtual file. Download Zotero, which is Citation Manager, and you can see here as far as searching research projects, creating research projects, print out books, look at research papers. All these things are very important. However, when I look at this amount of steps and I look at all these things that we have to do to make sure that we're involved in the research and we're performing at a level that's acceptable to today's standards, it's too much. In fact, I know it's too much because that's what I do on a daily basis, and I can't do it. I have a team of people around me. I have pretty much 15 maybe experts in the field that feed me research on a regular basis. I can't decipher it all. I've got another group of people who take that and turn into about 20 to 30 papers that we turn into maybe 10 papers that we can actually implement into ChiroUp and use on a regular basis, on a monthly basis. It takes a lot of effort to be an evidence-based provider. But here's the thing, that evidence, that work, that grit as far as getting through that research is worth it. Patients love it. And the reason they love it is because they get results. So if we can take and really define our niche and what we do in our practice, for me is to get people in and out of pain as fast as possible, teach them the tools to understand their problem and to solve that problem if it comes back in the future. If I can solve that with each and every patient, then I'm going to have a very successful practice because they know that's where they go. If you wanted to get the best razor, would you get this razor's okay, or would you get Gillette, the best a man can get? If you wanted to get a great car, would you get this is a pretty decent Toyota or the ultimate driving machine? You're going to go for the company that has a specific niche that does one thing well. And as far as us, I think, as far as the research things, as far as what I can back up, we kick butt as far as getting people out of pain. We're great at it because chiropractors as a profession have a modality that no one else has. Our method as far as spinal manipulation, when applied appropriately, is awesome. It works so well. Start to use it on the patients who fit into your niche, and then market the hell out of it because people want to get out of pain. That's not a shrinking market of people in your area, in your community. Make sure you have a way of getting that out there as far as through Google reviews, Facebook reviews. You can do direct mail. You can do anything as far as MD letters, initial reports, release reports, newsletters. whatever it is that fits into your niche, that's what you need to do. So I hope this helps, but I really want to thank the person who made that Facebook post, because it really outlines how difficult it is to be an evidence-based provider, but how rewarding it also is. ChiroUp hopefully makes that process very simple. We have a board of directors, myself and Dr. Berlman, who do this on a regular, all day long, do this, and we try to make it easy and efficient on the rest of us to practice at the top of our game, because that is going to be the future of healthcare, and we are just grateful to be a partner in that care with you.